The resources. If you go to any of the websites of any of these organizations, they will tell you where practitioners are. You can find practitioners. In other words, if you, and also another one for chelating docs is ACAM, www.acam.org. Because one of our biological dentists here was saying, hey, I'd like to hook up with a medical doctor that doesn't think I'm absolutely nuck and futz, and see if we can work to take care of patients. And so using those, that's a resource. And here's what's even, she lives in North Carolina. And everybody in this room, we all need to do what the North Carolinians have done. North Carolina has the NCIMS, North Carolina Integrative Medical Society. And that was created because the North Carolina board borrowed one of their integrative doctor's licenses for 2 months. And so he was able to go, he took that sabbatical to go around and talk to all the docs, and was able to build a foundation for the North Carolina Integrative Medical Society. Who can be a member of it? Anybody that has a health-related license. Nurse practitioner, medical assistant, dentist. I mean, anybody that has a license, a health-related license, can be a member of NCIMS. And the North Carolina Medical Board has come to respect them greatly because they realize, oh, these folks are now a force to be reckoned with. And also NCIMS, they have seminars, get-togethers, and some of the best I've attended. But every state ought to have their own, there ought to be a Georgia Integrative Medical Society, Kentucky Integrative Medical Society. I mean, every state, it has to happen at the state level. And so, but one way to find a practitioner is Google the different places. Each organization will have listings where you live. Does that make sense? So, thank you for mentioning that, and because I always want to encourage everyone to think about getting an integrative medical society in your state, because it's that everything happens at the state levels, and that's where we need to meet them head on. Cadmium. Now this gets depressing. Chocolate. Come on, man. Tobacco. In tobacco, cadmium is used in one of the processes of processing tobacco. Rubber tires. Oh darn. We got the gasoline, got the lead out of the gasoline, but now we got cadmium fuming off the tires running up and down the road. Doggone it. And so cadmium is another one of our more toxic elements. And it's kind of a sneaky one. I'll ask my patients, if you put metal in salt water, you're going to get some corrosion. Yeah? Well, if you have a rust-proof tool in your sweaty hand, one of the things that makes it rust-proof is the cadmium. And so you got a sweaty hand on a cadmium-laden piece of metal, and the skin's absorptive, and there you go. So another way you can get cadmium. Cadmium is another one that's been related to increased cancers. It's a neurotoxin. There's just nothing good about cadmium whatsoever, other than maybe it's okay in batteries. But stop eating the batteries. And it's ubiquitous in the environment. It's another one that's been found in the cosmetics. And so it's a frequent flyer. And it's what folks know about. And I've chosen these four because they're kind of like the ones that most folks know about. So, arsenic. I thought this was a great sentence. Arsenic has been known and used since ancient times as the poison of kings and the king of poisons. All right, CCA, chromated copper arsenate. That is your treated wood. And if your treated wood has not been sealed with anything, then, just think about all the picnic tables and the wooden swings, the things the kids play on. Oh, darn. And because they've checked the soil around treated wood, and the soil has more arsenic in it than they should. I mean, the further away you get from whatever the runoff is. And so that is one place where we can get the arsenic. Also, arsenic is commonly found in seafood. And there are some recommendations that before you do a provocation test, that it would be a good idea to not eat any seafood for like a week beforehand. But that means you'd have to get in touch with the patient the week before, but something to think about. On the other hand, I kind of don't make a big deal out of it because if they see a bunch of arsenic, they go, oh my goodness. It gets their attention. And it's there anyway. I mean, so, but it's just kind of a shame that all the wonderful wooden tables and picnic tables and swings and such, that with the treated wood, arsenic. And I only mention gadolinium just because it's commonly used, it's the contrasting agent used in MRIs. And of course, the radiologists are going to tell you that it's totally inert, doesn't react with anything. However, in July of 2015, they said, well, maybe we need to look at this gadolinium stuff being deposited in the brain. And but there is a chelating agent for gadolinium, and like I said, I just heard about it last night. I don't remember the name of it, and I'm not certain that it's readily available here in the United States. Goodness forbid. But some folks feel like they are having different issues from the gadolinium after they have the MRI. So if you work with a radiologist, I think they get an extra fee for reading the MRI with the contrast. So they don't want to give that up. And I don't know exactly how much it helps bring things out. Maybe it helps greatly. All right, chelating agents. The intravenous route, yes sir. One thing that comes to my mind on that is that is there something in the methodology of the testing? Because what I'm trying to flash back on it, just not working out. But in one of the testing okay, yeah, he's a good guy. And it could be like you said, is it the water? But I'm wondering if it's something in the testing methodology. Not that you're doing anything wrong, but is something been introduced unbeknownst to you? And so might talk to the folks at Doctors Data and see if they have any thoughts, because I believe they're here. I don't think Metametric is here, but Doctors Data, I believe, is here this week. And so I'd run that by those folks. Yep. Yeah, we're going to talk about that when we talk about penicillamine. Uh, Another interesting phenomenon is some people are just metal magnets. It's incredible. There's one gentleman from my hometown that he'd been a triathlete, and the first time I met him, he was too proud and arrogant but he looked like Howdy Doody just trying to walk down the hall. And this guy had been a triathlete. And I think after about 60 chelations, it's kind of like, well, where did he go? He didn't come back. And I saw him at a health food store, standing there, just still as he could be. I was like, oh, really good. And he's come back since then. That was about 15 years ago. And then he had come back for a little bit of a tune-up there for a while. And so you're going to see people like that for whatever reasons just suck in the metals and they can't get rid of them and become symptomatic. And IV removes a whole bunch more metal than you can ever remove trying to do it orally. Is it wrong to do it orally? No. I mean, I put cilantro on my food with a regular basis. Take chlorella on occasion. EDTA is the king of chelating agents. I'm here on page 34. Even though it has a high affinity for mercury, it doesn't do a good job of chelating mercury. And so we use other agents. The one that most clinics use the most is DMPS. Use it intravenously. And it is put into the bag when the bag is down to about 1/3 or 1/4 right at the end of the EDTA chelation, and put it in at that point. And you definitely would want to put it in before you do a provocation urine so you can see how much mercury is coming out. But then, people like me, at the back few pages are my doctor's data urines. And so I do a fair amount of DMPS on a fairly regular basis. I got a lot of mercury. And it's interesting. Yes, ma'am. So you say what now? Oh, you're saying there's a delayed reaction from the exposure, and if you do DMPS now, later on you're going to be compromised. I've not heard that. I mean, that's interesting. So, but that's what you've observed, or do you remember reading it, or? Huh. And it's interesting. DMPS is okay in Europe, and it's not exactly smiled upon here in the United States for whatever reasons. It's not that toxic, and a little bit later I'm going to talk about how we dose it, so try to reduce the side effects. But DMPS chelates out. We use it primarily for mercury, but it gets lead, arsenic, cadmium, silver, tin. It will also pull out the copper. Well, hang on for just a second. And it makes a comment here, if a large amount of copper is chelated out but very little mercury, then the patient should be evaluated for Wilson's disease unless you live in Boulder, Colorado. Now, the DMPS dose, and that's what you would get, according to the gospel, 3 milligrams per kilogram, and the line is a maximum dose of 250 milligrams. Well, let me tell you about that 250 milligrams. My clinic, as well as other clinics, noticed side effects when you use 250 milligrams. And so I have not used the 250 milligram DMPS this century. We use 125 milligrams and it seems to work out. Now I say that, but if someone has kidney compromise, you're going to want to cut it back a little bit from that, and then we'll go over that in just a little bit. But I would not use the 250 milligram dose. You're going to see side effects. And we still seem to get adequate metals coming out with 125 milligrams and no side effects. So, nausea, usually it's mostly gut type issues. I'm just not feeling good. Now, DMSA. Now, I believe that DMPS, you can get it in an oral form. I've never seen it. Never heard anybody has anybody used DMPS orally? You do. Y'all get it from the compounders here in the and in a minute here I'll come back to you. Then also, but the one that's used more commonly is the DMSA, and DMSA is okay here in the United States, whereas the Europeans don't like it much. Go figure. And I don't know if DMSA can be obtained or used intravenously. I imagine it could, but we pretty much use it orally. The DMSA, do any of the dentists have you guys been using it? So, DMSA chelates mercury, lead, arsenic, and gold, and doesn't seem to suck up the calcium, magnesium, iron, or copper. And the dosing is 10 milligrams per kilogram, and at the most 30 milligrams per kilogram a day, with a maximum dose of 1,500 milligrams a day. Did y'all see that sentence in there? It's on page 35. We could probably spend the rest of the day getting different protocols for administering DMSA. And a lot of places it's used is if someone is going to have their amalgam fillings taken out, using it before, during, or after. And there are different protocols. There's one, I put one here. Take it Friday, Saturday, and Sunday, and then you're off for 11 days. But then there are other protocols where you take it Monday, Wednesday, and Friday right at bedtime for 2 weeks, and then stay off for 2 weeks. I mean, there's several different protocols, but you definitely just don't want to take a whole bunch of it all the time. It's not a good idea. And then there's also thoughts about does it, if someone has silver fillings, don't chelate them. Wait till they get all the silver fillings out, because you're going to mobilize it and destroy their brain. I don't know. I mean, there are different thoughts on that, and I don't know how much of it is true and accurate. And then there's another one about don't give DMSA while someone still has mercury in the mouth, because it will loosen that filling. And so, is any of the biological dentists heard any of that? Or so, I don't know if it's absolutely necessary to have all your fillings out before you do any of the DMSA or DMPS. Yes, ma'am. I'm hearing impaired. What is possible? Right. I've listened to all these arguments back and forth at different conferences, and back when Ted Rosema was more active, if he was at a conference, I just shouted him. You would think I was his bodyguard or something, because I would listen to people ask him questions and how he answered. And some folks feel that, hey, if you're taking a chelating agent, you're getting it out regardless. And then if you look at the smoking teeth, it's kind of like, what, it's coming out anyway. So, getting it out any way you can is probably better than not, waiting and putting all kinds of hurdles, and, someone might not be able to afford to get the amalgams out, so forth and so on. So I'm always just going to go ahead and chelate it, but educate them and say, hey, if you got silver fillings, might want to think about it. I encourage everyone to get them out anyway. One of the last ones, D-penicillamine. Now there's some other chelators, but these are the greatest hits: DMPS, DMSA. D-penicillamine It primarily is a copper chelator and is used in Wilson's disease, but it'll also get the iron, mercury, lead, arsenic excreted by the kidneys. Has anyone used D-penicillamine? It's a prescription. I've not used it. And then I mentioned down there the cilantro, which is also known as coriander, Chinese parsley, and also the chlorella will help get the mercury out. So anything you can do to get these guys out, it's a good idea. And I couldn't resist. I was just going to talk about some of the supplements. Vitamin C is most remarkable. In 1948, Dr. Frederick Klenner documented curing 60 cases of polio using intravenous vitamin C. I don't know if you knew that. Vitamin C itself is also a weak chelating agent. I encourage all of my patients to take vitamin C twice a day, start at 1,000 milligrams, and every week go up another 1,000. In other words, 1,000 twice a day, 2,000 twice a day, 3,000, until they get stomach cramps or loose stools and they back down below that dose. And I was talking with one of our participants here earlier and asked him this question: why is it dogs and cows and birds don't have heart attacks, but humans do? Yeah, except for the fruit bat, the guinea pig, a few monkeys, and I'm going to give you the full answer. There's some subspecies of salmon and some kind of weird foo bird in South America, and the human being. That's it. Everybody else makes their own vitamin C. We don't. And so one thought is that atherosclerosis is like subclinical scurvy, because blockages of plaque occur on vitamin C deficient portions of blood vessels. The animals, they get food. They make their own vitamin C 7 days a week, 24 hours a day. We can't do that. So taking vitamin C is a real good idea. Yeah. You can get so, I'm sorry, you can get so, do you want non-Chinese? I mean, you can carry it all sorts of places. And so I had one patient that figured out, and I thought he was a genius, because I would have never figured this out. If he takes the magnesium ascorbate, he'll get loose stools very quickly. But if he takes any other form, it's okay. He tolerates it. So just kind of heads up. I don't know that there is a best form of vitamin C, obviously, because I'm not selling any vitamin C. There's the liposomal C, powdered vitamin C. Dr. Russ Jaffe, who's a big proponent of the D-penicillamine, he has a routine where he calls it the vitamin C flush. And that's where folks will take sodium ascorbate, like 1,000 milligrams every hour, until they have like a quart of water coming out of their rectum. And in some patients, that they just feel great after that. I mean, it's sort of like I guess an enema or something like that. But so which form, I don't have any idea. I don't know of a bad form exactly. And so, but I do know that it's really, really, really important to take it. Really important supplement. Vitamin D. I stumbled into a lecture in ACAM in 2004 out in Las Vegas, and Michael Hollick was giving the talk. And I was like, 10 o'clock, I came in the room and like, okay, what's the next lecture? Vitamin D. I'm like, I'd rather sit out in the lobby and drink coffee and watch ladies or something. Vitamin D is going to be boring. And I took a look at Dr. Hollick and I was like, this guy, boy, was I wrong. One of the best lectures I've ever heard. Guy's fantastic. Great. And so vitamin D, huge. Everybody in this room ought to be taking enough vitamin D to get your blood levels up 60. 50 is at a bare minimum. 60 is better. Up in that range is good. Every cell in our body has a vitamin D receptor. It's amazing. And I tell folks, or tell my patients, if you got a bathing suit quality tan yesterday, or you spent 30 minutes at your news colony yesterday, then you don't need vitamin D today. But it's got to be a bathing suit quality exposure. Because I've had a whole bunch of folks, guys with arms just as brown as they could be, and their vitamin D levels were low. And so it's got to be a full body kind of exposure. It is not a good idea to take calcium. I don't know if y'all, if Tom Levy's going to be here today or not, but He is a good old boy from Mississippi who is a cardiologist who stumbled into Hal Huggins' office out in Denver, I think, and just blew him away. He kind of had the same aha moment and like, wait a minute, what's going on here? And he's probably one of the world's leading experts on vitamin C presently, but he's published a book, Death by Calcium. And the according to him and his research, the regular intake of calcium supplements and or dairy is detrimental, and it makes every known disease worse. We don't have a calcium deficiency. We need the magnesium to get calcium to the bone and the vitamin D to activate the bone cells, but we don't need calcium. Yes, sir. Thanks. Anybody else? Any other insights? Um, Magnesium, the metal involved in more chemical reactions than any other metal in the body, and most of us are deficient in magnesium. And on the blood test for magnesium, 1% of our magnesium, our body's magnesium, is in the blood. The other 99% is in the cell, in the mitochondria. So looking at a lab test about magnesium or blood test on magnesium. It's like I'm going to go buy 100 cows, but all I got to do is look at one, and I'll pass judgment on the other 99. And so you're taking too much magnesium if you get the milk of magnesia side effect, loose stools. And so taking magnesium, good idea. And if you just take a little bit of magnesium, you get diarrhea, you're in the percentage of folks that, for whatever reason, your body's been able to hold on and hang on to magnesium, and you don't need to take it. But most of us do. N-acetylcysteine. Either N-acetylcysteine or L-cysteine. This is the way to increase our body's glutathione. In all of our cells, the glutathione recycles vitamin E, vitamin C, the lipoic acid, the lipid peroxides, and like I mentioned earlier, in the lining of the lung, and also in our other cells, it activates the enzymes that help get metals out of the body. And so, several studies on cysteine and what it does. Getting more glutathione is a really good idea. Just in a story. I'm a big fan of taking a B complex, all the Bs, and methylfolate is about 20% of the population is lacking the enzyme, which is the last step our body uses to convert folic acid into methylfolate. And that last enzyme is known as MTHFR, methyltetrahydrofolate reductase. And I tell folks, if you just throw in a couple of vowels, pretty easy to remember MTHFR. And accordingly, if you overhear the mothers of autistic children talking about the MOFO gene, you now know what they're talking about. That's what they've nicknamed it. They're not talking about the father, they're talking about the genetic defect. And it's a biggie. Also, another problem is livers over 40, we don't do as good a job of converting folic acid into methylfolate. So if you're over 40, probably forget the folic acid, take the methylfolate. So and citrulline, because we deal a lot with folks with atherosclerosis. Bless you. The citrulline is the amino acid to take if you want to up the body's production of nitric oxide. And it works, you get more nitric oxide produced by taking citrulline than if you take arginine. And then alpha lipoic acid, thiotic acid, lipoic acid, they're all one and the same. It's both water soluble and fat soluble. And a lot of it's used intravenously. Bert Berkson pioneered using this for a lot of the folks with liver disease. Also, it has a reputation of being able to be used in peripheral neuropathy. And finally, here on page 39, we're going to talk about calculating these doses. All right. So you got your patient. You need to know their height, their weight, and their last creatinine. And most of us use pounds, and so we have to convert that to kilograms. So you divide the pounds by 2.2. This sheet here is something I came up with. Someone please make it easier, or I'd love to see it. I'd like to see an improvement. We need to upgrade this. And so I tried to do it so the gals in my office could just plug in the numbers. That's the way it's supposed to work. After you do it a couple of times, it's not that hard. And there's only one trick on this whole page, and that is there are two different weights. There's the actual weight, and then there's the lean body weight. And that's what we're calculating here is in the center of the page, the lean body weight, LBW is lean body weight. Now, if someone, like you can tell that my lean body weight is probably going to be less than my actual weight. I would not be surprised if if you weigh less, then we would calculate it out. I mean, just being blessed with thinness. So just whenever you do this, think about the patient to help keep you from making a mistake on how much you're going to use. For ladies, the way you figure out a lady's lean body weight is 45 kilograms plus 2.3 kilograms for every inch of height over 5 feet. Sue is 5'9". 2.3 times 9 is 20.7 plus 45 gives you the number of 66.2. That would be Sue's lean body weight. And down below that, Joe is 5'11". For men, it's a little different. 2.3 times 11 gives you 25.3, and you add 50 to get 75.3. What if Joe is 6'2"? Then he's actually 5 feet 13 inches, 15 inches tall, right? All right, Joe he's all of a sudden, instead of being 5'11", he's 6'2", and so he's actually 5 feet tall, 13 inches. And so you'd use the 5, huh? Is it 4? What did it say? Yeah, thank you. I get over 3, I have trouble. I get lost. So, and you plug those numbers back up there, up towards the top. 140 minus the age times the lean body weight times 1.33 divided by 72 times the creatinine. That gives you the creatinine clearance. Yes, ma'am. Best you can do. And obviously, if someone they were okay and then went to heck in a handbag, then you'd want to get a fresh one. And that's another convenience of starting at the first IV. Like I said, a vitamin and mineral, you can, find out exactly where you are. So don't confuse the actual weight and the lean body weight. Now, then down there, sort of at the lower 1/3, 50 times that number, lean body weight times 1.33, times the creatinine clearance divided by 100, that gives you the dose of EDTA, and it gives it to you in milligrams. So you're going to get kind of a big number, but remember, move the decimal point over to the left to turn it into grams. And then it's not unusual to have someone calculate out, and you're going to watch the creatinines, and also the size of the person, and also the age, because you can tell from the equation up there, the older they are, that's going to make your numerator higher, and so that's, you want to make sure if someone's young, good creatinine, you're going to tolerate 3 grams. And it's not unusual to have all this calculated out. It says you can take 4, 5, 6, 7, 8 grams. You're not going to do that. It's going to be 3 grams. But with an elderly lady who's thin, you got to make sure that you don't want to give her too much. And then down at the bottom of the page, the DMPS dose, and I think I just went ahead not to confuse the staff, don't give more than 125 milligrams. But if their creatinine clearance is compromised, don't really have a Krakow gaunt for that. We'll use a little bit of Kentucky windage to bring down the dose. Does that make any sense? When you try to hit the mark, which way is the wind blowing? Okay, that's Kentucky windage. Y'all ain't heard that, huh? Any questions about any of this? Because it's one of the things you really, really need to do. And like I said, if you can figure out how to make it simpler or more obvious, please share it with me. Because y'all got to help the next class. Because I probably will be doing this again until I can sucker someone else into doing it. But I'd love to see your improvements on the documentation that we do. Now, let's take a break right now.